Hello, I'm Dr. Sam Bandularatne. Let's talk about meningitis. We have received many inquiries from patients wanting to know more about meningitis and the meningitis vaccine. Your brain and spinal cord are extremely delicate organs, protected by the bony skull and spine. But what many people don't realize is that beneath the bone, the brain and the spinal cord are surrounded by a thin protective layer, almost like a cushion. This layer is called the meninges. Infection or inflammation of the meninges is called meningitis. Meningitis is most commonly caused by a virus, but bacteria and occasionally other organisms like TB can also be the cause. Viral meningitis is often milder. Bacterial meningitis can be severe and sometimes life-threatening. Because the meninges have a rich blood supply, the infection can spread into the bloodstream. This can lead to a dangerous condition called sepsis, sometimes referred to as blood poisoning. This is why recognizing the symptoms early is so important. The illness can start like a simple flu, but can quickly become very serious. A key sign is a dark red or purple rash that does not fade when pressed with a glass. This is called the glass test. However, it's important to remember that a rash may not always be present. Patients may report the following symptoms: sudden high fever, worsening severe headache, stiff or painful neck when trying to move it, sickness or vomiting, bright lights hurting eyes. Other warning signs can include severe muscle or joint pain, very cold hands and feet, confusion, difficulty concentrating, extreme sleepiness, seizures, or collapse. If you notice these symptoms in yourself or someone else, please do not wait. Call 999 immediately or go straight to A&E. Why? Because prompt diagnosis and treatment with an intramuscular or intravenous antibiotic when meningitis is suspected is life-saving. It's commonest in young children. Infants are most at risk from infection. Teenagers and young adults are prone to this illness as this age group tends to carry a lot of meningitis, causing bacteria also called meningococcus in the back of their nose and throat. The good news is that meningitis is a rare disease. The bacteria and viruses that cause meningitis spread through close contact, such as kissing, sharing drinks or vapes, or spending long periods of time close to someone, for example, living in the same household. Interestingly, many people carry these bacteria in their nose or throat without being ill themselves, and this is often how the infection spreads. Here is what everyone wants to know. Vaccination has dramatically reduced meningitis cases in the UK. There are two main meningococcal vaccines used. The MenB vaccine protects against group B meningococcus, which is the most common cause of meningococcal disease in the UK today. The second vaccine is the MenACWY vaccine. It protects against 4 other types of meningococcal bacteria, A, C, W, and Y. These vaccines do not replace each other because they protect against different strains of the bacteria. Here is some bad news. The vaccine is unfortunately not a silver bullet. It doesn't offer complete protection against meningitis. Vaccination is not the only or the quickest preventive measure for people potentially exposed. A single dose of antibiotic called ciprofloxacin is offered to close contacts of MenB patients. Meningitis is rare, but it can progress very quickly. If you or someone around you develops fever, severe headache, neck stiffness, confusion, or a worrying rash, seek urgent medical attention immediately. Early treatment with antibiotics can make a life-saving difference.